right, class, here we go. We're doing chapter 7, which is all about the skeletal system. So I'll break it up into 3 parts so you don't get overwhelmed with all the material. So if you just start off with looking at the bones, total of 206 bones in the body, and it's divided into the axial skeleton, which is 80 bones, and then you have the appendicular skeleton, which is the upper extremities, the pelvis, and the lower extremities, hands and feet, which is 126 bones. Okay, so again, the axial skeleton, which is the skull, the thoracic cage, the vertebral column, the sacrum, which makes up the axial skeleton of 80 bones. And then you have the appendicular skeleton, which is the upper extremity, the scapula, the pelvis, the hands, and the feet, 126 bones. So you want to look at the skull. Here's the hyoid bone, which is right here. You've got the clavicle, the scapula. What I would do is, if you really want to learn this, is maybe you can white out all this and see if you can name it. You know, there's a worksheet on Canvas that I've also made that you can help practice learning the bones. But you should start here. Learn the basic bones, set the foundation down, and then go from there. You always want to look at the big picture before you zoom in on the small little details. Sometimes we get focused on the small details and forget the big picture. Okay. So I've broken this down into more details now. So if you look at the axial skeleton, the skull has 8 cranial bones, 1 frontal, 2 parietal, 1 occipital. You have 14 facial bones. You have the maxilla, the zygomatic, you have the palatine, the inferior nasal conchae, your mandible right here, your lacrimal glands, your nasal, and your vomer in there. So that's 22 bones. You have the smallest bones in the body, which is the malleus, incus, and stapes, and those are found in your middle ear. Obviously, you have 3 on one side and 3 on the other, so a total of 6. You have the hyoid bone, which is right here, and I'll talk a little bit more about the hyoid bone a little bit later. The vertebral column, there's 7 cervical, 12 thoracic, 5 lumbar, 1 sacrum, 1 coccyx, which is your tailbone, and that's 26 bones. The way I remember is I eat breakfast at 7, lunch at 12, dinner at 5, 7, 12, 5, and then snack at 1 and 1. There you go. Okay. Thoracic cage, you have 24 ribs, 12 on each side, and then you have 1 sternum. So the thoracic cage itself is 25 bones. As far as the appendicular skeleton, that's 126 bones. Remember, the axial is just 80 bones. And then the appendicular is 126. Okay, so 60 plus 60, 4 plus 2, 126. So the scapula and the clavicle, there's 4 of those. In your upper extremity, each upper extremity, you have 30 bones. So on my right upper extremity, I have 30. In my left upper extremity, I have 30. In my right lower extremity, I have 30. In my left lower extremity, I have 30. So I have a humerus, a radius, a ulna. I have 16 small little carpal bones. I have 10 metacarpals, and then I have 28 phalanxes. Okay, the hip bone, I have 2, the right and the left, and they come together. They articulate. And then in the lower extremities, I have a femur, tibia, fibula, a patella, 14 tarsal bones, 10 metatarsal, and again 28 phalanxes. So a total of 206 bones. Now, when you start studying bones, you want to look at the ways that we describe that. So here's some terminology that you want to get used to. Condyle. When people say condyle, so occipital condyle, which is right back here, that's the rounded process that usually articulates with another bone. Articulate means join, okay, with another bone. Crest is just like a crest, right? Narrow ridge-like projection. So if you touch your hips, that's the iliac crest. Okay. Epicondyle is the projection situated above a condyle. So condyle is a little bit bigger and the epicondyle is a little bit smaller. But you know how people say, oh, I hit my funny bone? Well, when you hit your funny bone, you actually irritate the ulnar nerve. But this is the bone. This is called a medial epicondyle right in here. The facet are small, nearly flat surfaces. The costal facet of the thoracic vertebrae, they're like this. The fontanelle is a soft spot in the skull where membranes cover the space between bones. So kids have these fontanelles. So if you look at a small little baby, you can actually see their heart go boom, 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 and that's the fontanelle. They have anterior, posterior. They have mastoidal and sphenoidal fontanelles, and I'll talk about those a little bit later. Foramen is an opening through a bone that usually is a passageway for blood vessels, nerves, or ligaments. Foramen meaning opening, magnum meaning large. So the foramen magnum is right here. That's what your spinal cord goes through. The fossa is a relatively deep pit or depression. The olecranon fossa is back here. Fovea is a tiny pit or depression. You have these little tiny pits in your femur. The head is an enlargement or on the end of a bone. So the head of the humerus is right here. You also have a head of the radius. So when you're describing a bone, you want to describe it, the feature plus the bone. So you want to say head of humerus, head of radius. Because if you just say head, I don't know what bone it is because there's multiple features that can be found on different bones. Medius is a tube-like passageway, so the external acoustic meatus in your ear. Process is a prominent projection, so if you touch right behind your ear, you have the mastoid process back here. The sinus, just like it sounds, you have a sinus here, and you have sinus when you get sick. You're like, oh, my sinuses are all clogged up. Those can get filled with mucus and bacteria, and you can get infection in there. A spine is a thorn-like projection, so you have the spine of the scapula. So if you touch the back of your scapula, you can feel that. That's like a spine. Sulcus is a narrow groove, so if you go right here, and sometimes it clicks because the bicipital tendon will pop out of that groove back and forth, but that's called the sulcus. Okay. Suture is an interlocking line between bones. You have sutures between your skull. You have the frontal bone, you have the occipital bone, you have the parietal bone, and you have sutures in between that will hold them together. Now remember I was telling you that babies have fontanelles, so they haven't come together yet, but once as an adult, they're sutured in, and it's nearly impossible to break them apart. Trochanter. You have the greater trochanter of the femur. So the femur is your thigh. Tubercle is a small knob-like process. So the difference between a trochanter and tubercle, if you look, trochanters are larger. And you know that the femur, which is your thigh, is larger than your humerus, which is right here. Tuberosity is a knob-like process, usually larger than a tubercle. So think of it as tubercle, then tuberosity, then trochanter. If you had to put it from small, medium, large, or tall, grande, venti, you know. Okay, skeleton is derived from Greek and Latin words meaning dried framework. Bones are very active living tissues. Each bone is made up of several types of tissues, bone, cartilage, dense connective tissue, blood, and nervous tissue. So if you ever broken a bone, people say, why does it take so long to heal? Well, it's not just the bone that you're irritating, you're breaking, or you're irritating, you know, some of the connective tissue, the blood vessels, the nervous tissue, and cartilage. So all that needs to heal. Why do you have bones? Well, muscle attachment, protection, support of soft tissues, blood cell production, and storage of inorganic salts. And of course, they bear the weight and allow movement. So very important for you to have a skeletal system. Now, there are different types of bones. You have a long bone with extended examples. So your arm and leg bones are long. You have short bones, which have almost equal length and width. Examples are wrist and ankles. Sometimes you have some round bones called these sesamoid bones. They're small nodular bones that develop within the tendon. A special type of short bone is called the patella, which is your kneecap. Not named after my ancestors. Okay. Flat is a plate-like shape with broad surface. Examples are your ribs, your scapula, and your skull bones. Those are flat. And irregular they have different shapes. Your vertebrae, some facial bones are irregular. They don't really have a rhyme or reason for their shape or structure. That's why we call them irregular. Now, if you look at the structure of a long bone, you're going to want to know what this terminology is. So expanded ends of bones that form joints with adjacent bones are called the epiphyses. So the ends of the bones are called epiphyses. The shaft, which is the middle part, is called the diaphyses. A long bone continues to lengthen while the cartilaginous cells of the epiphyseal plate are active. Once the plate ossifies, the bone can no longer grow. So let me put this in perspective. Epiphyseal plate is also known as your growth plate. During puberty, you might have a rapid growth spurt. You will grow as long as the epiphyseal plate is active. For females and most males, your epiphyseal plates and your long bones will close around 16 to 18, mostly 18. So your arms and legs will no longer grow after 18, but the epiphyseal plates in your spine will grow until about 25. So really, if you're under 25, you're like, oh man, that means I can still get taller. Yeah, I mean, you can go from 5'1" to 5'1.5" and 2. You're not going to go from 5'1" to 6'1" between 18 and 25. That doesn't happen. But you could go from 5'1" to 6'1" between ages of 12 to 18, because that's where most rapid growth takes place. Okay. You have a tough layer of dense connective tissue called the periosteum, which covers the bone and is continuous with ligaments and tendons. Sometimes when we have a fracture, we'll tear the periosteum. And then articular cartilage, hyaline cartilage, covers the epiphyses. Articular cartilage is hard to replace, if at all. So once you tear the articular cartilage, there's not much you can do. So when patients come in and say, hey, I'm bone on bone, well, their articular cartilage is no longer there to comfort there, and they are rubbing truly bone on bone. Bone shape makes its function possible. Bony processes, projections, provide attachments for sites for tendons and ligaments. Let me tell you the difference between a tendon and a ligament before I go. A tendon attaches muscle to bone, and a ligament will attach bone to bone. So just to kind of clarify. Again, tendons attach muscle to bone, and ligaments attach bone to bone. Okay. You have openings for grooves for blood vessels and nerves, and you have depressions for articulation for other bones to attach. So there's a lot of things that can be found on a bone. There's two types of bones. There's a compact bone and spongy bone. Compact bone, just like it sounds, is very tightly packed tissue, which makes up the wall of the diaphyses. Very rigid, very strong. The epiphyses are filled with spongy bone, so the end is filled with spongy bone or cancel bones, which reduces the weight of the skeleton. If you were all compact bone, you'd walk around very difficult for time for you to walk, and then you'd have trouble with your throwing, as your upper extremity would be so heavy. So the spongy bone takes some of the weight off, and it gives it flexibility as well. They have branching bony plates called trabeculae. The diaphyses contains a hollow chamber called the medullary cavity. The medullary cavity is lined with a thin layer of cells called the endosteum. And the medullary cavity is filled with a special type of connective tissue called bone marrow. I don't know if you like to eat bone marrow. Obviously not of humans. It could be pigs or beef. I've never had it, but people say it's pretty darn good. I don't know. Never had it. Here's where you can find the bone marrow. You have red marrow and yellow marrow. Okay. You have skull, vertebrae, sternum, ribs, part of the pelvic girdle, and proximal heads of the humerus and femur is red marrow. Most of you will not eat this, obviously not in the humans, but not even of beef or pigs. What most people like is the marrow of the long bones because it has mostly fat, and we love fat. So there it is. That's what it looks like. So people like to eat the middle part of that. I don't know. It doesn't look too appetizing to me, But then again, I've never had it, so I don't want to judge. But people say that they've had it, they love it. But again, like I said, it's mostly fat. Who doesn't love fat? I mean, if you look at escargot, which is snails, they cook it in garlic and butter. I mean, hell, you could cook anything in garlic and butter. It probably tastes good. So same thing with this concept is, yeah, it's bone marrow, but it's mostly fat. So that's what people like it. Okay, so here is a diagram of the long bones. So again, the ends are called the epiphyses. The shaft, which is the middle, is called the diaphyses. And then here's the distal epiphyses. There's the yellow marrow inside that people like to eat. The medullary cavity. You have compact bone. Remember, that's rigid and tough. And then you have spongy bone at the end that makes it more flexible. If you look at these lines, these are your epiphyseal lines or your growth plates, so you grow from there, right? As long as those are open, then you'll continue to lay down cells and you'll actually grow. Once those shut, which is around 16 to 18, then you're no longer going to get any taller. Okay, and then this articular cartilage, which is found at the end of the bone, is shock absorption and prevents the two bones from rubbing together. Eventually, this does wear out. It's like tread on a tire, it wears out. And unlike tread on a tire, you can't go to Costco and get a new pair of wheels. Sometimes, I mean, your only option is a total knee or a total hip replacement, okay, because the articular cartilage is gone and the bones are rubbing together. Here's if you were to look at spongy bone versus compact bone. So remember, compact bone is rigid, solid. This is where we get our strength, and the spongy bone is what gives our bones flexibility. So we have the best of both. So it allows us to walk, run, throw things, but you have to have a combination of compact and spongy bone to do that. Now you have three different types of bone cells. Well, let me rephrase that. The first type you have are osteogenic, osteoprogenic cells, which are stem cells. And if you remember from biology, stem cells haven't decided what they want to be yet. So these osteogenic cells are, depending on where they are found in the body or what their function is, they'll either turn to osteoblasts, osteocytes, or osteoclasts. Now you want to know this. Osteoblasts are the bone forming cells. Okay, so they form bone. When you're a little critter, little baby, your osteoblast activity is going to be high because you're just forming bone left and right. Boom, 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 boom. Once you reach a stable age, your osteocytes are going to be the majority of it, where they just maintain your bone cells. Okay. Now, osteoclasts are your bone dissolving. So they help keep that homeostasis that we talked about. If you have too much osteoblasts and not enough osteoclasts, you might build up too much bone. But as you get older and osteoclasts outpace osteoblasts, then you're breaking down more bone than you're building, and there's osteoporosis, right? So there's different pathologies that can occur if these three cells are not doing what they're supposed to do. So just to reiterate again, osteoblasts make bone. When you're younger, your osteoblast activity is high because you're growing. Boom, 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 boom. Right now, you're done growing. You've reached 18. All your epiphyseal plates have closed. The osteocytes are just maintaining their bone. Okay, and then as you get older, osteoclasts are going to increase in activity. Now, who is more susceptible to osteoporosis? It is usually Asian women and Caucasian women. A lot of that in the Asian women has to do with diet, lack of calcium, and some Asians are also lactose intolerant. So that sometimes plays a role in calcium. Okay, so keep that in mind. Let's see. Again, osteocytes maintain bone tissue. Osteoblasts make or form bone matrix. Osteogenic is the stem cell, so they can turn into osteoclasts, osteoblasts, osteocytes, so they're stem cells. And then osteoclasts will break down or reabsorb the bone. Here's another diagram if you're more visual. If you look at the concentric circles, this is what gives bone its strength. If you ever chop down a tree and you look at their annular rings, bone has similar concentric rings that give it its strength. Okay. So again, you have compact bone here and spongy bone. You can see the vast blood supply in bone, which is one of the contributions for bone to heal real fast. Remember, your body heals mostly through blood supply, and bone has one of the best blood supplies. That's why it heals so fast. Okay. Again, why do we have bones? Well, support and protection. Bones give shape to the head, the face, the thorax, and the limbs. Bones such as the pelvis and lower limbs provide support for the body's weight. Bones of the skull protect the eyes, ears, and brain. Bones of the ribs and shoulder girdle protect the heart and lungs. Bones of the pelvic girdle protect lower abdomen and reproductive organs. So very important. Movement. Bones act with muscles to cause movement of limbs and other body parts. What's the function of bone? Hematopoiesis is blood cell formation. So red blood cells, white blood cells, they do form in the bone. Blood cell formation begins in the yolk sac during embryonic development. They are later manufactured in the liver and spleen, and then finally in the bone marrow. There's two kinds of marrow occupy the medullary cavities. I briefly introduced that to you. That's the red marrow and the yellow marrow. Red marrow occupies the spongy bone of skull, ribs, sternum, clavicles, vertebrae, and pelvis. Functions in the formation of red blood cells, white blood cells, and platelets. So the red marrow is very important. The yellow marrow, as I mentioned before, stores fat and occupies most cavities of bone. So the yellow marrow is what most people eat. The red marrow, they don't eat that. Okay. What are some other things that are stored in bone? Well, you have extracellular matrix of bone, which is rich in calcium salts, mostly calcium phosphate. Calcium is important in many metabolic processes such as muscle contraction, nerve impulse conduction, and blood clotting. Calcium in bone is a reservoir for body calcium. When blood levels of calcium are too low, osteoclasts release calcium from bone under the influence of the parathyroid hormone, so that's where homeostasis comes in. When blood calcium is too high, then osteoclasts are inhibited and osteoblasts are stimulated to deposit bone matrix by the hormone calcitonin. So we want to get that back to homeostasis. Bones also store magnesium, sodium, potassium, and carbonate ions. Bones also accumulate harmful metallic elements such as lead, radium, and strontium. So, when kids are younger and they like to play in the playground and put everything in their mouth, we can test them for lead poisoning. Now, I'm not a big soda fan. I'll have an occasional soda here and there, but one of the main reasons that soda is so bad for you is A, the sugar, but also the phosphorus. Now remember, your body is constantly trying to find a balance, homeostasis between whatever it takes, but calcium and phosphorus seem to balance each other out. Now if I drink a lot of soda, which is high in phosphorus, especially diet soda tends to have a higher amount of phosphorus. Well, if I have that, the body is trying to equalize that, so what it will do is it will leach the calcium from the bones to counteract the phosphorus that's in the blood, right? So what I'm trying to tell you is one soda is fine, but if you're constantly drinking soda after soda and soda and you have a high amount of phosphorus, then the body is going to try to counteract that by leaching the calcium from your bones. Okay, so you're saying, well, what if I take calcium if I drink soda? Why don't you just try to eliminate soda versus, right? Because we don't know the absorption rate of calcium supplements, et cetera, et cetera. Try to get all your nutrition from natural foods versus supplements. Okay, because we don't really know how much actually makes it down to the cellular level. Again, so soda, there's sugar, there's corn syrup, you have aspartame in the diet sodas. You have the caramel color, which can stain your teeth. You have these additives. Again, phosphoric acid can lead to osteoporosis because it is leaching the calcium. And then, of course, there's sodium. Diet soda has been linked to an increased risk of stroke because there's a high sodium content in there. So just avoid all that stuff. going back to hormonal regulation, calcium homeostasis. Remember, we have to find a balance. So if there's decreased blood calcium, it stimulates the parathyroid hormone secretion from the parathyroid glands, which are found behind. Here's your thyroid glands, so the parathyroid are behind there. The parathyroid hormone stimulates osteoclasts to break down bone and release calcium into the blood. In the kidneys, parathyroid hormone increases calcium reabsorption from the urine, and parathyroid hormone also stimulates active vitamin D formation. So then vitamin D will promote calcium absorption from the small intestine into the blood. Increased blood calcium stimulates calcitonin secretion from the thyroid gland, and the calcitonin inhibits osteoclasts, which allows for enhanced osteoblast uptake of calcium from the blood to deposit into bone. So it's a whole process, and you don't even have to think about it, right? So if you follow this, steps 1, 2, 3, 4, 5, and 6. Okay, so that's how they regulate the calcium levels. Now again, just to reiterate, bone reabsorbing cells are called osteoclasts that break down the calcified matrix, and then bone building cells are called osteoblasts. So if you look at this, radiograph, you can see that that's not an adult because these epiphyseal plates are still open. You're thinking, oh man, there's a lot of fractures here. No, this is just a child's hand and they're still developing. So it's going to lay down cells, so they will elongate here. And as long as these are open, it'll continue to grow, grow, grow. You can also look at the wrist. Some of these bones haven't even fully developed yet. Okay, so that's why you can tell this is a child's hand. Again, reiterating that osteoclasts reabsorb the osteoblast deposit bone throughout life in a process called bone remodeling. An average of 3 to 5% of bone calcium is exchanged each year. Nutrition-wise, vitamin D is needed for calcium absorption. Most adults do have a deficiency in vitamin D, especially if you don't go out in the sun. Hormonal secretions, there's growth hormone, stimulates division of cartilage cells. You have sex hormones that stimulate ossification of the epiphyseal plates to end growth in height. You definitely want physical exercise. When muscles pull on bones at their attachment, it stresses the bone, which causes it to increase thickness and strength. If you don't lose it, or if you don't use it, you lose it, right? So this is why we encourage patients that have osteopenia, which is the precursor to osteoporosis, to do weight-bearing exercises. That's the best way to prevent further, because you're going to stress the bone. So the body's going to say, oh, if they're putting stress on it, I'm going to have to lay down more osteoblasts so that osteoclasts don't break it down. So if you look at this, the females at the age of about 50, when you start hitting menopause and estrogen and calcium levels start to decrease, that can lead to bone loss. For men, they lose it steadily, so it's rare for men to get osteoporosis, but it can happen. But it's very common in Asian women and white Caucasian women. Okay. So this is where it starts to go down, and this is what we call flexed posture, and she can get the dowager's hump that we've seen in some patients. Okay, the best thing to encourage is exercise, walk, and take vitamin D and calcium. Now again, we don't have to worry about this, but in developing countries where they don't have access to nutrition, there's a disease called rickets, and that's due to a lack of vitamin D and calcium, where the bones start to malform. And unfortunately, this is not curable, but if we can have access to good nutrition, then we can prevent that early on. But once it starts to get like this, it's very difficult to treat. Now, if osteoblasts or growth hormone deposits too much bone, then we get something called acromegaly. I don't know if you ever watched WWE wrestling. Andre the Giant and This is the Great Kali, and then there's Triple H, but a lot of them have a very similar facial structure. This is called acromegaly, where they're laying down a lot of bone because of overstimulation of a growth hormone. Usually they don't live too long because it's very taxing on the heart. So the taller they are, the less the life expectancy it is. But this is called acromegaly. Okay. All right.